Gastrointestinal cancer surgery, is it safe during the period of COVID-19? This is what I would be talking about. I am Dr. Deepak Govil. I am a senior consultant and head Department of Gastrointestinal Surgery and GI Oncology at the Indraprastha Apollo Hospitals, New Delhi. And I'll be talking about this on the platform of therightdoctors.com.
Insights from the world's best medical minds. You are watching therightdoctors.com.
Good morning. I'll be talking about the gastrointestinal cancer surgery during this period of COVID-19. Is it getting affected or not? Are these patients getting affected or not? Are the main concerns today? Because all the patients are afraid during this period of COVID-19. And I'll be talking about this in various forms, like how are the patients affected during this period of COVID-19? Is it something different? And are we treating these patients or not? Are we operating these patients or not? And what is the message we want to give to these patients? So how are these patients affected patients of gastrointestinal cancer is what I would be talking first. And we are seeing that the patients are, I think it's but natural, are quite affected by COVID-19. Everybody is scared to go to the hospitals. Everybody is scared to go to any common place or for any treatment. So that is why patients are really ignoring their symptoms. If they have minor symptoms, they are just ignoring them, and they're coming. We are seeing that these patients are coming quite late to us, and we are seeing patients with complications. With the patients with intestinal cancer are coming with either obstruction or bleeding, which are the emergency situations. They are not coming in an elective situation to us. So that is what is really, and patients who are just delaying surgery, because initially we felt that probably, yes, maybe after a month or so things will settle down and then we'll get the treatment. But now since it's lingering on and we don't know how long it is likely to last, so the patients are really just delaying the things. And we are seeing patients who had a localized disease who could be treated if they were treated in an early situation, who could be treated almost completely. They are coming in a very late stage to us. They are coming with liver metastasis, with metastasis to other areas. So that is a fear which I really want to bring out of all of all of the patients, because the hospitals initially, yes, there was a lockdown and we were only doing emergency surgeries. We were not doing elective procedures, but now gradually I think we are going into a new normal, and we are now starting all the investigations, all the managements as we were doing before. But the patients definitely, I can see, are scared and coming to us very late with complications, and therefore the results also obviously suffer. So this is what I would advise, that don't ignore these things. And the COVID-19 is there, but obviously with these cancer patients, there has been a scare that these patients will get affected more. The chances of problems having are more with these cancer patients, the patients who are on chemotherapy, patients who are on radiotherapy, or who have been operated, they will be affected more by COVID-19 if they get it. Yes, that is there. We take all precautions. We don't say that you don't take precautions. But in the hospitals, we have all the facilities. I'm at Indraprastha Apollo Hospitals, where we have all the facilities which are working in a normal way. And even with the COVID patients, we have a separate unit where they're fully segregated. So there is no fear for the patients to come to the hospital and get themselves treated. So that is the first thing which I would like to address. And now, have we really changed our strategies during this period of COVID-19 for treating these patients? So I would say yes, definitely. Like initially, we have delayed treatment where 1 or 2 weeks of delay would not make a difference. We would prefer to delay and do the surgery later. But now, since things are continuing, we are starting full treatment. And initially, our plan is like some patients who can be given the initial treatment of chemotherapy and radiotherapy, and then followed by surgery, which is also called as neoadjuvant treatment. So there are a lot of GI cancer diseases like in colorectal cancer, esophageal cancer, in gastric cancer, where there is a role of neoadjuvant treatment. So we prefer to keep these patients on neoadjuvant treatment, and this helps us in deferring surgery for a period, because this neoadjuvant treatment will take 6 to 8 weeks, and then after that we wait for 6 to 8 weeks. So we postpone surgery, but we don't postpone the treatment of the patient. So that is one important strategy which we are following. Wherever applicable, we start with a neoadjuvant treatment and then follow it up after waiting for an adequate period for surgery. And with this, we can get a window period of almost 2 to 3 months, and then we can operate these patients. But now, since it's lingering on, we are almost getting patients who've already got a full treatment of neoadjuvant treatment and now are ready for surgery. So we are operating these patients. There is no doubt we are doing all investigations. We are operating these patients. And here comes the role of multidisciplinary treatment. Multidisciplinary means we have a board where we have a medical oncologist, where we have a radiotherapy person, where we have a surgeon, we have a pathologist, we have a radiologist, and we all combine and scan and scrutinize the clinical file of the patient and devise a proper treatment which is tailored to that particular patient. So there is a role of multidisciplinary teams for treating these patients. And emergency surgeries, yes, we are doing any patients who come to emergency, even if we have to take a risk of COVID, like we all test for a COVID test before we plan for a surgical procedure. And rarely, if we are not able to test, then we take all full precautions as if we are operating on a positive patient and perform the surgeries. But in an emergency situation, definitely surgical procedures are being done. If a patient has bleeding, if a patient has intestinal obstruction, and the patient is going nutritionally down, then we don't delay it further and take him up for surgery. Now, regarding surgery, are we doing surgeries? Yes, we are doing surgeries for these patients. And surgery, there have been some modifications in our surgical techniques which we do, the precautions which we take. I would be talking about what changes in the technique and what are the precautions we are taking while operating on these patients. So while operating on these patients, first of all precautions which we take as if we feel that the patient is positive, and we take all precautions accordingly. Like we use PPE wherever they are required, we use masks and adequate masks, adequate face cover, and all the precautions which are required. And especially precautions while operating are taken during the induction of the anesthesia and when the anesthesia reverses. These are the two times when the chances of the spread of the virus are more. Therefore, we have to be very particular during this period, and we let the anesthetist and minimum people stay inside the operation theater during this period, and we stay outside. Once the intubation is done and our anesthetists say okay, then we take up the surgical procedure with all the precautions. And after the surgery, again for anesthesia extubation, again we go out of the operating room and wait for the extubation, and then the patient is shifted. And the patients are kept in ICUs, which are separate. We have all precautions of our all healthcare workers at the hospital, where we take full precautions preventing spread of COVID-19 in the healthcare workers or to the patients. So that confidence I really want to give, that at Apollo hospitals we are really following all guidelines of ICMR, WHO, all guidelines are being followed, and we are able to perform all major surgeries. So we're doing all GI cancer surgeries, which are like pancreatic cancer, intestinal cancer, colorectal cancer, esophageal cancer. All these are being operated at Indraprastha Apollo hospitals. Then certain specific precautions during surgery, like there is a lot of hue and cry whether we can do laparoscopic procedures or robotic procedures during this period. There are precautions which are taken for the spread of the aerosol while we are operating, because we inflate the abdomen with some air. So a spread of the aerosol is an important thing which we have to take care while we are operating. And we have all facilities of smoke evacuators which are being used for these procedures. And we are doing all laparoscopic and robotic procedures for gastrointestinal cancer patients also. Then important thing is that if a patient has turned positive by any chance, and then he's recovered from it, then while you are operating, are there any specific precautions you have to take, or you can just take him up as a normal person? Yes, in intestinal surgery, this is an important part, because we've seen, and the literature, as whatever is available as of now, is showing that the virus stays in the intestine for a longer period and stays in the stools for a longer period. So if you have to perform a colorectal cancer surgery or an intestinal surgery, then you take full precautions as if you are operating a positive patient. We operated a patient recently where we wore all PPE measures and operated the patient as if they were positive. And this is mainly to decrease the spread of the virus to the healthcare workers and the operating team and the whole atmosphere. So these are the specific precautions which we take while we operate these patients. And in the end, I would like to give a message to our patients who are suffering from GI cancer disease, that don't delay your problems, don't ignore your problems. It's an important thing, because if you delay, a treatable or almost curative treatment can get delayed, and we may not be able to give a full curative treatment if the disease spreads further. Or if we are operating in an emergency situation, then obviously the results are less, the outcome is less better as compared to if we are operating in an elective situation. So now I think we have gone over a significant period. We've already waited 3-4 months, and now we are operating on elective situations also for cancer disease especially, and we don't wait further. So my specific message to all the patients suffering from GI cancer disease is, the full treatment is available at the hospitals with all the specialties, and I would advise, then don't ignore your symptoms, don't delay your symptoms, just identify them. And other patients, like another thing I want to add is, if there are patients who have been treated for cancer and are on regular follow-up, those are the patients who can probably wait for some time, because they get regular investigations done every 3 months or 6 months or yearly. If they have to get the investigations, then they can probably wait for some more time and get when things are a little better. So those are the patients who can probably wait. But other patients who have a problem, I think you contact a doctor. And this is what I would advise, that uh, don't get delayed. And in the times of COVID-19, as for everybody, I think stay safe. That is the most important thing. Take all precautions so that you avoid getting infected by the virus, and get yourself treated at proper hospitals. This is what our aim is, and this is what we want to give a confidence to you all about. That hospitals are there, tertiary care hospitals are working full time now, and I think you can easily go and get yourself treated without any fear or scare. This is what I would like to say.
Insights from the world's best medical minds. You are watching therightdoctors.com.